everyone. Welcome back to Talks with Tina. I'm super excited to have my friend and partner, Bill Farah, with me, and he is a principal in Deloitte Consulting's practice. Bill specializes in technology-enabled transformation to support the advancement of population health strategies, which we all know is a really hot topic right now in the healthcare world. As a practicing physician, so he won't let me call him doctor, but he is a doctor. He's a health system executive and consultant, and he's worked across health plans and health systems to really drive value-based, patient-centered models of care. And right now, Bill is known by me and many members of the firm and really the community as kind of the virtual health go-to guy. And I'm really honored to have you here, Bill. So thanks for joining.
Thank you, Tina. It's great to be here. And thanks for the warm introduction.
Oh, absolutely. And so, hey, we're going to jump right in. I've got a couple of questions for you, and I'm sure everybody's interested in hearing your perspectives. When you think about virtual health adoption has been noted as this like silver lining of the pandemic. How do you expect that virtual care will continue to evolve in 2021 and beyond?
Yeah, Tina, you know, it's hard to believe that anything positive could come out of such a tragic time that we've had to endure for the last year and continue to endure. But hopefully this is one of those things. And, you know, I did my first virtual health strategy at UPMC 12 years ago.
Wow.
And so I don't think it's hyperbole to say that we've advanced more in the last 12 months than in the previous 12 years.
Yeah, we've come a long way, baby. Like that's.
Yeah, we have. And I think the best for sure is yet to come. So, you know, I think that, you know, traditionally people have viewed virtual health as a substitution for in-person care. And I think that the main evolution that's going to happen over the next couple of years is we're going to evolve from an or proposition to an and proposition. And virtual health is just going to become part of the way that we take care of patients. And it's the way that we build relationships. It's the way that we stay in touch with people. It's the way that we stay close to people. So, you know, when we think about friends, family, how we engage with others, it's not only in person. Yes, we love to get together in person and it adds richness to our relationships, but certainly talking on the phone, texting, FaceTiming, all of those aspects of communication are important and continue to build relationships. So I think that as we start to think about the way we can stay in touch with our patients, the way that we can become more of the fabric of people's lives, the more that we can move patients to the center of healthcare, virtual is a wrapper that allows us to do that. So I look forward to that evolution happening and really moving from substitution to transformation.
Yeah, that's awesome. I like virtual as a wrapper. That's a good tagline. And if you're a healthcare leader and you kind of think about, you know, facing some of the challenges as you continue to implement and optimize your virtual health platforms, what are the key things that they should be focusing on?
Sure. I think a lot of organizations right now are struggling with what we just talked about. So they stood up virtual capabilities very quickly. They had to. It was an emergency situation where they just had to put things out there so that they could take care of patients. Now, I think is as people think about this holistically, what is an overall strategy? How do I evolve, like we just talked about, and move into that transformation phase of virtual health? And to do that, we need to really think about the care model differently. We need to think about how we integrate technologies. We need to not repeat some of the mistakes we made with electronic medical records and just jamming in technologies, but really be mindful and thoughtful about how we engage patients and how we engage clinicians to make these tools really intuitive, simple, and effective. So I think there's a huge opportunity to meet that challenge head on this time and learn from those mistakes. The other challenge that we're starting to see is that there's a real opportunity to really bridge the divide in health disparity and health equity. But the flip side of that is if we're not careful, we can actually increase that chasm. So some of the initial studies that are coming out are showing that there is a risk that we could be furthering the divide as it pertains to health equity, where in reality, there is a real opportunity to start to close that gap. So I think the other challenge is, again, being mindful of health equity and really building systems and programs that can address it.
Yeah, because if you don't have a smartphone or you don't have access to a computer, then how do you have access to virtual health? And striking that balance is going to be really important going forward.
Absolutely. But, and to that point, virtual health doesn't have to be a smartphone, right? We've seen great results with just texting. And in fact, a lot of patients like to engage with just texting. So if you have telephonic interaction and text, if you can go a long way, and you can build satellite community health centers that really rely on extenders and other members of the healthcare community that could have a computer and be in touch with a doctor in real time if necessary. But there, again, are different ways to think about how we render care. It's not traditional models anymore, and there's not just one way to do it. So I think if we really get creative when you think about different care models, but just keeping the patient in mind, we can build those models that truly start to address some of the disparity and health equity problems that we're experiencing in our country.
Yeah, and I know I personally have loved having the ability to text my primary care doc, or, even I think about when my kids were growing up and I was a working mom and my kid has an ear infection at 8 o'clock at night, how much more convenient and supportive will virtual health be in those circumstances? So I hope it continues to evolve. It's super exciting times, and thanks for all you're doing to kind of further the progress here, because it's been pretty amazing.
No, it's my pleasure. And I'm so glad you used that example because, again, you think about if we're not careful, you can further fragment the healthcare landscape, because I'm going to go to urgent care for this, or I'm going to go to my doctor for that. If you're available as a physician and you have that relationship, you'll continue to tap into that relationship. And what you just said is a perfect example. If I can email or text my physician who I have a relationship with anytime, and they'll be responsive to me, why wouldn't I do that? I'm going to do that over anything else. And, the regulations that are accelerating in terms of reimbursement now that had hindered telemedicine are really opening the door for the kind of interactions you just said that are going to be allowed by the system instead of inhibited by it.
Well, and think about how that could advance like chronic care management, right? So if there's more interactions and patients will reach out, maybe they'll take their pills more frequently or follow the regimens that have been recommended. So that's really cool and great to think about.
Absolutely. Again, great point, because then you're engaging in a dialogue, right? It's not you come to my office every 3 months. We have an ongoing, I'm getting data about you. There are analytics in the background that can prompt me to do actions. There are analytics in the background that can prompt the patient to do actions. And that's how you get behavioral modification, is that continual dialogue that's happening in an organic way, instead of this artificial, you need to come into my office every 3 months and somehow I'm going to change behavior. That's just not going to happen.
Yeah.
So, when we enable predictive and prescriptive analytics in real time, that's how patients start to get engaged, and that's how we can help people take better care of themselves and help them to be really part of their own care.
Yeah, no, I love it. Well, listen, this was really insightful. Thank you so much for joining, and look forward to hearing about all the exciting things that you'll be doing with our clients. So thanks again, Bill. Have a great day.
You too, Tina. Great to talk to you.
Take care.